confirmed in all 50 states. Dr. Anthony Fauci says the highly contagious variant will account for over 90% of new cases within the next week or two. The Biden administration announced new steps to fight this surge. And even though Omicron appears to be less severe, the sheer number of cases could still overwhelm hospitals very soon. So to break this down, let's bring in our ABC News contributor and Chief Innovation Officer of Boston Children's Hospital, Dr. John Brownstein. Dr. John, thanks very much for joining us again. Good to see you.
Good to see you too.
So let's start with President Biden's speech yesterday, where he outlined the administration's plan to tackle the Omicron surge in cases, the distribution of 500 million free at-home testing kits. That was the headline out of there. Now, they aren't going to be available until next month. The president and his administration getting some pretty stiff criticism for that. How important is testing, and is this too little too late?
Well, testing has always been one of the most important pillars of our response to this pandemic. And, it's great to see this commitment to testing, but the Omicron wave is here. And so it's a little bit, too late to help with the current surge, right? We need tests right now. People are making decisions about gathering, they're making decisions about flights. They're dealing with these long wait times to understand their infection status. That's what's needed now around this current surge. Mid-January, we may be on the other side of Omicron. This thing sweeps through really quickly and may be on the downswing by the time these tests are available. That's why other cities, are pulling together to offer free rapid testing. I know in my city in Boston, they're offering free rapid testing to people to increase that capacity. But so the Biden plan is great. I just think it's a little bit late to have real impact right now.
So after 2 years, we're still kind of struggling with that. 2 administrations, but let's switch now to Omicron itself. How severe is it? Is there enough data for you to get a handle on, is it more severe, less severe than Delta? What does the data tell you?
This is the question that everyone's asking. We know it's more transmissible than any variant, and it's going to cause millions of infections. But, that's the denominator. What is the numerator? How many people will get severely ill? That is a question that's very hard to answer. We're looking at other countries that have already had a wave. It looks to be in the range of 30 to 70% less severe than Delta. So that's good news. But when you have that many cases, the concern is you bring this variant into the US, have that much infection, it will have an impact on our health systems. The question is how much? We have to remember that we have not been able to predict often very well what is going to happen with this pandemic. So we sort of have to prepare for the worst, but there is sort of nice data to suggest that, it may not be severe like the other variants. But again, this is why testing, vaccination, all of these things that we know are so key to combat this current wave.
A silver lining to what is still a pretty big cloud with this variant. Just hours ago, Doctor, the FDA granted authorization of the first antiviral pills, the Pfizer pill there, but there is going to be some limited supply at first. How big a development is this in the pandemic?
I think it's a game changer, really. I mean, the clinical data was really exciting. 88% of hospitalizations would be prevented if you take this pill within 5 days. And so, this is a pill for those who've been recently diagnosed and experiencing symptoms. This is not a preventative tool. It's not for if you've been exposed. You have to have symptoms, and you also need a prescription. We have to be concerned about equitable access. We've had a concern around vaccines and testing in terms of really making sure the whole population has access. That's going to be a concern for this pill. And as you mentioned, supply is going to be constrained. There's only going to be tens of thousands of tests until the end of the year. That's not enough given the numbers of infections we're seeing right now in the population. So this will play a big role, and especially in the new year, I think this therapy is going to be super important, but we can't hang our hat on it. Vaccines are still our key right now.
Right, but it is good news there. So there is an urgent care provider, CityMD in New York, announced it will temporarily close some clinics across New York City and New Jersey. This is one of the major urgent care providers there due to staffing concerns stemming from the Omicron variant. So how big of a worry are these staffing issues, not just in the Northeast, but nationwide?
It's a huge concern, and this is why we spoke about the issues of rapid testing and how they can help supplement for the capacity that we need right now. We know that our health systems are overrun, and so our testing capacity is no different. People are just burnt out, and we're losing staff across the board. And without testing, we can't tell who's infected. We can't make sure that they isolate, and this means that we can't prevent transmission. it also means that we have blind spots in understanding, what is happening with this pandemic. So I have a concern that this is going to continue to be the case. And this is why, yes, of course, these rapid tests coming in to the supply are going to be great, but we need this sort of capacity like right now, immediately.
And to continue to try to take care of each other, not spread the virus, so that those staffing issues don't become critical across our healthcare system. You mentioned testing. There are some results that we can discern. And for moms and dads, this is critical. The U.S. registered 170,000 positive tests among children last week. That's up 28% in the past 2 weeks. It does seem, I guess, you straightened me out, that Omicron children are more vulnerable to Omicron. What do you tell parents of children who are too young, under 5, to get vaccinated about holiday gatherings and about this particular variant?
Yeah, well, the jury's still out on specific Omicron in kids. We know that, large portions of our kids are unvaccinated either because they've yet to get the vaccine or they don't meet the age requirement. But this is a real concern. I mean, these are vulnerable people that maybe do not withstand the severe consequences of COVID like adults, but they still can get really sick. And we know that there's long-term consequences of COVID infection in our kids. So we want to protect them. The best thing to do is anybody that's around them to be vaccinated. If you're eligible, make sure you're fully vaccinated and boosted if you're also eligible for that. We know that that will dramatically reduce the opportunities for virus to move within a household to your younger kids. And then it's all the same things. Masking is super important, good ventilation, making sure to avoid sort of large indoor gatherings, all the kinds of things that we've been talking about throughout, our segments. Again, and testing too. If you test, household members, people that are interact with your younger children, that will give you all those layers of intervention to help keep our kids safe and make sure that they can enjoy a nice holiday as well.
It's great advice, Dr. Brownstein. And as we have been talking to you throughout this pandemic, some days are darker than others. There's some silver linings that we were talking about, and it's good. Absolutely. It's good to see the light at the end of the tunnel.